Hi there, it's Dr. John Rogetzky from New Life Physical Therapy in Westfield. Just want to come today with a top 3 exercise group here looking at 3 movements that are really good for low back pain. Now, this is typically for low back pain of a more long-term duration, longer variety, as opposed to, you tweaked it in the backyard or you have a disc with some radiating leg symptoms going on or things like that. Older folks, not necessarily exclusively to, but they typically respond well to this. And if you have some hips that are maybe a little bit stiff, this set of movements generally works well for you. So let's start off with our movement. Overall, what we are going to try to do is sync up the hip movement and pelvic movement along with low back. So hands on hips, hands are going to be on hips for all of these, and that's an important fact. What we're trying to do is trick your brain a little bit. Your brain pays a lot of attention to your hands, not as much attention to your hips and your pelvis like that. So we're putting your hands on your pelvis to make your brain pay more attention. So we're going to assume a slight stride position. My hands are low on my hips, and then I'm doing a forward rock. And then what you're going to notice is that I get a little bit of a tilt to my pelvis, and I'm using my hands to help encourage that. This hand pushes down while this hand pushes up or helps lift up a little bit as I do that rock. Okay, number of reps is very low with all these. You're going to see me do about 3 per side on each of them. So I do the same thing. I'm pushing forward from this back hip. I'm letting my hands rock my pelvis a little bit, and I just glide. Now I'm going to go with my backside to the wall. I'm going to do a very shallow squat where if you look at me, my hips and my knees are bending together, but if you could see me from the side, you'd see that my knees aren't jutting out forwards. I can still see my toes if I look down because I'm sticking my hind end back and I'm not overloading the front of my knees. My hands again are on my pelvis to make me pay attention, and what I'm trying to do is just create a little bit of a forward roll to my hips. It's a very small squat, should be pretty easy to do. And then you can see me lean forward along with it too. Lastly, we're going to work on some sideways movement around your back and your pelvis. And what I'm doing is I've got my elbow against the wall to support me. I'm very, very close to the wall, only a couple inches away on this one. My hand is, yep, on my pelvis. And then I'm doing a push. If I could turn my arrow to show kind of a shove into the wall, I'm using my hand to kind of push my hip into the wall, and I'm lightly hip checking the wall with my cheek on that side. My shoulders lean away a little bit, so I'm not getting any compression in my low back, and I can just feel a little stretch on the outside of my hips. And we do a few glides each side, flip around, my elbow's on the wall to support me, my foot's pretty close to the wall, my hand's on there, and I give a light push over to the wall just to glide me and let my shoulders tilt. So that was 3 exercises to go after low back, especially if you have some hip stiffness along with it. As always, if this is something you're dealing with that hasn't been seen by anybody in the medical profession yet, take care of business first if you need to. Always contact your New Life physical therapist if you have any further questions. Otherwise, as always, take care, be well, and keep moving.